Hello everyone! Magandang araw po sa lahat, Luzon, Visayas at Mindanao at sa lahat ng Pinay saan man sa mundo. I am Dr. Shi Armero, your friendly OBGYN and lifestyle medicine specialist, and you are watching DANGPANAN, a live series of Doc Shi TV. We do this every Saturday at 4 o'clock in the afternoon simultaneously in YouTube Doc Shi TV and in Facebook Dr. Shi Armero OBGYN Lifestyle Clinic. The goal of this program is to give education in various social media platforms to empower you, Pinays, to take charge of your health through correct and science-based or evidence-based information. DANGPANAN, a Bisaya term for shelter, is chosen to be the name of this program because I want to share this comfort of good education to all of you, my viewers, through a platform that is accessible to all. Welcome to another educational Saturday afternoon. And what's more, you do not just learn, you can also share these blessings to others by giving everyone a chance to win a free online consultation coupon. So invite your friends, your relatives, by typing their names in the chat box or click the share button. And don't forget the hashtag DocShiTV, or in short, hashtag DDSTV. If this is your first time watching, don't forget to click that follow button at Dr. Shi Armero OBGYN Lifestyle Clinic Facebook page, or click that subscribe button in YouTube Doc Shi TV, and don't forget to click that notification bell for you to be notified on future videos.
DANGPANAN, kabahin sa panglawas o relasyon.
Doc Shi Armero.
Magandang hapon po sa lahat or sa lahat ng nanonood po sa atin, whether in the Philippines or outside Philippines. I am Dr. Shi Armero, ang imong DANGPANAN. Okay, I know you already want to win that free online consultation coupon, but before that, let us greet our viewers first. Thank you very much, Amadonna Lavides. Good afternoon then. From where are you? Thank you very much for being with us. Please type in the chat box from where are you watching so I can greet you. Thank you very much once again for gracing this afternoon full of education. So last week, we talked about those with previous cesarean section. And today, since we celebrated the World Sleep Day, so our topic is all about sleep this afternoon. And so, I prepared something about that, and please also prepare your questions. We have 5 questions from our followers in Facebook, but we will be entertaining, so we can be entertaining more of your questions from our viewers live. So be ready with your questions, and so sit back, relax, mag-notes para maka-answer sa tama o mali segment for you to win that free online consultation coupon. Once again, it's transferable. So if you think that somebody else needs it but does not have YouTube or does not have the Facebook, by all means, you can share that free online consultation coupon with them. Hello, Maria Everlyn Kesto Tabigir Rojas Nob. Hello. From Capital City. Oy, siligan rada ita, Madonna. Hello, Ate Jean, watching from Bohol. Leonila Barong also watching from Lahug. And we have also from Tagbilaran City, Ma'am Caroline Dakio. Thank you very much for all your greeting. So, as I said, again, we will be talking about sleep this afternoon. I hope this can also help you, especially those who are saying that they are suffering from insomnia. I'll be giving very concrete steps later. And those that in my video, I'll be asking it later. So please watch out for it. Hello, Dr. Javs Esther Ko, watching from Zamboanga City. Thank you for the support. Faith also, thank you. Eds Marie, thank you also. Good afternoon. Thank you for watching. Jean Palco, thank you from Manila. Ayun, na-challenge na tuloy talaga yung Tagalog ko. Okay, thank you for being with us. So, sa lahat, no, hello, yes, hello. Wow, Grace, thank you. Ano ka talaga, constant viewer. Thank you very much for being with us again this afternoon. Okay, ayan, nagtatag na si Faith ng more viewers to be with us. No? Thank you, Faith, for all your support. Later, you will see yourself. We have featured you. So, mag-ready ka na. Okay? So, all right. So, let's be ready with our, with the video on sleep first. Okay? So, here it is. We are celebrating World Sleep Day. Today's discussion will be all about sleep and you. Do you often have difficulty sleeping? Do you awaken during the night, gasping for breath? Does your partner say that your breathing stops when you are sleeping? Do you snore loudly? Do you have to get up more than twice during the night to urinate? Do you wake up feeling like you haven't slept or is exhausted? Do you fall asleep often during the day? If yes, then this video is for you. Hi, I am Dr. Shi Armero, and you are watching Doc Shi TV. Today, we are going to talk about sleep and you. So let's start with sleep and your health. Did you know that women are more likely than men to have insomnia and other sleep problems? Sleep affects mental and physical health. Thus, getting good sleep boosts mind and mood and can help prevent health problems. Changing hormones, especially among women during menstrual cycle, pregnancy, and menopause, can affect how well a woman sleeps. Why do women have more sleep problems than men? Why do you think so? Let's see. Premenstrual syndrome or premenstrual dysphoric disorder has 7 in 10 women say that they have problems going to sleep and staying asleep in days nearing their period. And also, among pregnant women, especially those in the 3rd trimester, experience discomfort, leg cramps, or frequent need to go to the bathroom. Also, there is precipitous decline in hormones and unpredictable sleep patterns when a woman is postpartum or after pregnancy already. And so these just gives us a concrete example why women have more sleep problems than men, especially in the different phases in our lives. And most of all, the very important phase, the perimenopause, especially when a woman already experiences hot flashes and night sweats. Most of the time, these women do not realize that they are already in perimenopause. And what they usually complain is that they have difficulty falling asleep because it just is too hot. And they thought, well, doc, it's March already, it's summer, and so it's expected to be hot. But even if it's not March, these women really complain that they cannot sleep well because of the feeling of warmth in the body. Okay. Insomnia is one of the most common sleep disorder, and it is defined as the inability to sleep or stay asleep, even given a chance to do so. It is associated with fatigue and irritability and can occur 3 times a week for a period of 1 month or longer. So if you are this person that it's already a month or so, and you are experiencing this difficulty falling asleep or staying asleep, then you have insomnia. According to statistics, in the Philippines, more than 10 million adults suffer from insomnia. And this is considered to be one of the highest rates of sleep deprivation in the world. So imagine Philippines is once again in the statistics of the world being one of the top most country with people suffering from insomnia. Apart from insomnia, what are the other common sleep disorders? We have, what's this? The restless leg syndrome. It is caused, or there is an unpleasant crawling and tingling sensations in the legs which occur when lying down. So kapag ang babae ay nakahiga na, usually this is experienced by those are pregnant. I mentioned earlier that there is that tingling sensation in the legs. There is also uncontrollable urge to move the legs. Symptoms occur when lying down. And when a woman moves, it is relieved. What do we do? So mostly the common cause of restless leg disorder, according to research, is iron deficiency. So if you are pregnant, you might be lacking that iron. You might be missing taking your iron supplement. So you take your Ferrous at least once a day, taken before meals or a slightly acidic stomach, so absorption is better. And what do you think is this in the photo? This is the shift work and sleep. So there are a lot of us who are not having a regular sleep routine because of shift of work. So those women with shifts in work has higher risk for breast cancer, cardiovascular disease, and irregular menstruation because, again, it's unpredictable. Their sleep pattern is usually unpredictable. There's irregular work schedule that can also put strain in family and social life, which can lead to stress and other emotional problems that worsen sleep. That's true, no? Do you know the song, Dito ay umaga at dyan ay gabi? So you belong in the same house, but it's as if you are in another time or place because your schedule is upside down in comparison to the other people in the house. Another common sleep disorder is, what happened to Sleeping Beauty? She's not just sleeping, but she is snoring. So sleep apnea is a common sleep disorder. There is temporary pauses in breathing during sleep. These pauses cause loud snoring, choking, and gasping sounds that disrupt sleep and lead to excessive daytime sleepiness. Though sleep apnea is common in men, this already is noted to be increasing in women, especially those in the perimenopause to menopause. Why is that? Number one, women at this age group are noted to be heavier. No? The obesity, or even when you are not in the age group of menopause or perimenopause, you are still in the reproductive age, but you are quite heavy, then the cutaneous fat dampen thermoregulation. And so there are problems in sleeping among these women. Also, as I mentioned again, those in the old age, because of low progesterone level, this affects the sleep quality as well. Among women who are pregnant who complain of frequent sleepiness, did you know it's because of the hormone progesterone? And so women in menopause with decreasing progesterone suffer from sleeping disorders because of the lack or the decrease of this hormone. What then are the benefits of sleep? Now, I cannot overemphasize because we know for a fact that there are several benefits of sleep. So if you are sleeping or during sleep, there is increase in melatonin. What is that melatonin? Melatonin is that substance that increases or that induces sleep. In fact, there are melatonin capsules that will help us fall asleep. Did you know that an increase in melatonin that happens normally when a person sleeps decreases affective disorders? Anong ang affective disorder, Doc? Affective disorders are those mood changes, depressions, no? Those are affective disorders. And so if melatonin is increased, there is inverse proportion for affective disorders or bumababa ang pagiging moody, ang pagiging having depressive mood. Healthy sleep duration and quality. Again, I would like to emphasize, hindi lang ang length of sleep, but the quality of sleep is equally important. So, a healthy sleep duration and quality lowers cortisol. What is cortisol? It is the stress hormone and glucose due to greater insulin sensitivity. So yung mga diabetic dyan or yung mga borderline, did you know that just by sleeping or having a good sleep duration and quality, it will help resolve or revert your glucose intolerance. Also, during sleep, there is higher daytime leptin. So pagkagising mo, the leptin is high. What is leptin? Ito yung hormone that reduces food-seeking behavior. So hindi ka nagki-crave. Kasi minsan, if you lack sleep, gusto mong kain ka lang ng kain. You crave, I want this, I want that, nag-order online. So if you have a good sleep duration and quality, if there is high leptin, there is reduced food-seeking behavior. So, papayat ka. There is also lower sympathetic tone and blood pressure if you have adequate sleep duration and quality, because your blood vessels adapt better if you sleep well. So sa mga hypertensive dyan, matulog. Also, there is greater nighttime peripheral perfusion and core body temperature cooling. So did you know, especially among perimenopause and menopause, naiinitan palagi during the night. They feel so hot and warm that they have difficulty initiating sleep, probably because they have had prior sleep deaths already. A good sleep duration and quality improves the perfusion. So if nag-i-improve ang perfusion natin, nag-i-improve din ang temperature regulation sa katawan. And so, para siya naging chicken and egg for those menopause. And so, kailangan you watch until the end. So, you will have the practical tips or you will learn the practical tips on how to battle all these. Also, nagkakaroon ng faster cardiovascular recovery time. Ano bang cardiovascular recovery time, Dr. Armero? Well, sa mga galing breakup, nakaka-recover agad. Hindi. For those with yung mga heart problems, nagpapalpitate, yung mga irregularities, nag-i-improve siya if you go to sleep and have a good sleep duration and quality. Again, it gives us a faster cardiovascular recovery time. There is also faster cognitive processing. Minsan, most of the time, if kulang ang sleep, naglo-load tayo, no? Parang processor kopong-kopong. Nagiging loading tayo sa mga knowledge, sa mga instructions, kaya tuloy napapagalitan. Kaya tuloy hindi nasusunod agad yung mga instructions because naghihina ang cognitive processing natin kung wala tayong sleep. And lalo na sa mga very strong family history of cancer, did you know that a correct or a healthy sleep duration and quality improves DNA repair and histone remodeling. Ito yung mga medical term or scientific terms sa mga substances or sa mga maliit-liit na bagay sa katawan natin that when this is endured or hindi nakakapag-repair ang DNA, magkaka-cancer. So, nade-develop yung cancer. May genes na nga tayo kasi si mama, si lola, si auntie, sino pa sa pamilya may ganitong cancer. Tapos hindi pa tayo matulog kasi nga stress tayo or ang daming trabaho. Yun, the risk of us developing the same will be higher. So matulog lang, no? Have a good sleep, duration, quality. So, how do we address all these? So, Doc, ang dami mong sinasabi na ganito, may problema kami. Oo, may problema ako, ganyan. May benefits ang sleep. But what are concrete actions para mag-improve yung sleep natin? So, ang tawag dyan, sleep hygiene. But I'm putting here and more. Because especially among those in the reproductive years who are really complaining of premenstrual syndrome. Ano bang premenstrual syndrome or PMS? Ito yung medyo masakit yung puson, sumasakit yung puson, ang bilis-bilis, ma-stress, nagagalit, no? Nagiging irritable, or order lang ng order. Dok, hindi ko mapigilan, gustong-gusto ko talagang mag-order, gustong-gusto kong kumain. And you usually observe this nearing your scheduled menstruation. So, kaya ang tawag, premenstrual syndrome. Okay? So, how do we solve this? So I have concrete examples or tips here. Number 1, eat food rich in complex carbohydrate. Huwag yung mga simple sugars, chocolates, huwag yun, mabilis yung ma-digest. So yung food rich in complex carbohydrate, yung mga whole grain. Or let's say pag nag-rice ka, yung brown rice, red rice, black rice, or wheat bread, kung gusto mong mag-bread lang, mag-wheat bread ka na. Number 2, exposed to bright light. Did you know that depression is higher among countries na palaging winter? Kaya siguro Pinoys are happy people because we only have 2 seasons here in the Philippines. The hot and the very hot. Kaya the sun is always bright in our side. Kaya we also have a bright personality. So for us to solve or for us to address premenstrual syndrome, you go out, magpa-init, magpa-sunlight ka. You have sunlight exposure in your body. Third, you do exercise. At least man lang 30 minutes every day. Ay, wag yung wag yung mild intensity. Doc, nag-exercise naman ako, naglalakad ako dun sa mall, nagmo-malling naman kami every weekend. Yun, naglalakad ka nga. But that is just mild intensity. The 30 minutes is at least moderate intensity. Kung kaya namang, anong tawag dito? Vigorous intensity exercise, mas okay yun. Especially in the luteal phase. So what is the luteal phase? Yun yung second half of the cycle, yung malapit na mag-mens. Yun si luteal phase after mo nag-ovulate. So, tanong, Doc, kailangan ba talagang naka-left side matulog ang buntis? Okay, so we are done with the reproductive age na hindi buntis, we go to the pregnant. My answer, preferably, yes, sa left side. Bakit? So let's say, first trimester ka. So if you notice, so dito, sa first trimester, I hope you can see my arrow. In the first trimester, pag naka-left side tayo, si stomach natin, hindi siya nakatumba. Okay? Para siyang bowl na ganun. So, hindi nag-regurgitate yung mga pagkain or yung mga iniinom or even pag wala kang kinain, even the gastric acid, hindi siya nag-regurgitate. Ang problem kasi among pregnant is yung gastroesophageal sphincter or yung lock between the esophagus and the stomach is maluwang. So, tawag natin doon gastroesophageal sphincter because nga of pregnancy. Pag naka-right kasi tayo, nakatumba siya, ganon. See, dito nakatumba. So, pag nakatumba siya, the gastric acid, talagang nagre-reflux siya. Kaya hindi ka makatulog kasi medyo nasusuka o medyo nagka-heartburn. So, ganon. Pag between the two again, dapat left side. in the first trimester. Pag malaki ng tiyan, doktora, ayan, may wrong at right tayo. Wrong yung naka-flat na ganito. Ang right is like this. Ito yung tamang position pag malaki na yung tiyan. Why? So if you notice, ang naka-left side lying na mommy, yung anong tawag ito, yung mga major blood vessels, ang tawag natin, aorta and vena cava. Si aorta is the artery, the vena cava is the vein. So ito yung mga major vessels na nagsusupply sa buong katawan natin, no? Galing sa heart. And so pag nakahiga tayong flat, nai-impede or anong tawag dito, na co-compress, nako-compress ni baby at ng enlarging uterus yung major blood vessels. Whereas, pag naka-side tayo, okay, ito, ayan, naka-arrow pa pala ako. Pag naka-side si mommy, hindi naiipit yung major vessels na nandito. So, kaya, this is the best position. Dapat naka-side lying si mommy pag malaki na yung tiyan. How about postpartum? Doktora, paano naman ako? Nanganak na ako, tapos hindi ako makatulog maayos. Did you know that sleep on your breast milk or your breastfeeding, those women who breastfed their children slept an average of 40 to 45 minutes longer than parents of bottle-fed children. Kaya if you are breastfeeding your child, good job. Mas nakakatulog ka. Hindi totoo yung hindi ka nakakatulog. So I will also give practical tips on how to manage your sleep pattern postpartum. So, ito yon. How can I improve my sleep with a new baby? Doc, iyak na si baby. Hindi na talaga ako nakatulog. Kaya nga sabi namin, mahirap manganak, but mas mahirap pag meron ng anak sa loob ng bahay. So, what are the practical tips? Number 1, sleep when the baby is sleeping. Matulog ka. Pag si baby tulog, matulog kang. Huwag kang magmoling-moling muna. So, sleep when the baby is sleeping. Number 2, don't try to do too much or to do everything by yourself. May partner naman tayo. May beshi naman tayo, no? May lola. Si lola really wants to help us. So, yun, don't try to do everything by yourself or mag-hire ka na lang ng yaya. O sige, sabi naman nila, mas madaling makahanap ng true love kaysa sa yaya this time. But you know, on the other hand, it will really be a good help for you to be able to sleep better when you have a new baby in the house. Kaya necessity siya, necessary. Number 3, have a partner, a friend, or another caregiver help take care of your baby for a while so you can sleep. Pag gustong-gusto talaga ni baby na kinakarga, gustong-gusto ni baby na mainit yung katawan because you know, our baby is used to the warm environment sa loob ng tiyan. Kaya gustong-gusto nilang malapit sa body natin, ano? So if you are afraid na baka madaganan mo while natutulog ka, so ask your another caregiver to help take care of the baby while you sleep, okay? Or para may support group ka, you talk with other mothers so that you can learn from their experiences. Or my post in Facebook might as well help you battle postpartum depression because I know how hard it is for you to be able to juggle being a new mother and all your other responsibilities. So you talk with other mothers as well. I am even one of the members of one support group for those breastfeeding because it's very hard. When I had my first child, talagang naiyak ako. It's very hard to breastfeed kasi hindi ko alam paano. I was blessed that my late mother-in-law is an expert in breastfeeding because ang dami nila. My husband, they are 4 siblings in the family, and my mother-in-law is breastfeeding them. So it was her who helped me. So she was somebody in the family who helped me breastfeed better. So I was able to fall asleep. Instructions nga niya, you do this position para breastfeed ka, pwede kang maidlip ng kaunti at without the danger of anong tawag dito, suffocating the baby. So may mga tips siyang ganon. So I was very blessed to have a part of the family who assisted me in breastfeeding. Or, join a support group of new mothers. Kasi, minsan, pag nag-ask tayo sa mga expert mommy, ay dapat ganitong ginawa mo. So, medyo na-o-offend ka kasi ang daming-daming advice. Pag hindi mo naman sinunod, sila naman yung ma-o-offend. So, you go with a support group of new mothers. It can help you also. So, practical tips for new moms. So, how can I address sleep concerns due to shifts? So, Doktora, mag-resign na lang kaya ako kasi sabi mo hindi healthy na shift yung work. Wag, may mga naman tayo may mga ways tayo on how to address it. At ito nga, light therapy and exposure, ang nagagawa ng light. It does not just improve your mood, but decreasing light after work induces sleep. So kung wari nagka-travel ka pa from work, mag-sunglasses ka na. Okay? So decrease light after work. You turn off or dim unnecessary lights, especially blue light. Doktora, ano po ba ang blue light? So yun yung mga blue light na nai-emit ng cellphone, ng TV, ng iPad, ng computer. So those are blue light. So kung sa akala mo, if you scroll over Facebook at nakakatulog ka, hindi. Because the blue light emitted in your cell phone while scrolling Facebook or YouTube, nakaka-affect ng sleep because of the blue light. So, you decrease light after work, most especially the blue light. Ayun, nasabi ko na, wear sunglasses upon going home. Also, eliminate caffeinated drinks. Ano ba yung mga caffeinated drinks? Anong tawag dito? Coffee, soda, tea. Those are caffeinated drinks. Also, avoid alcohol within 3 hours before bed. So, yung nagpa-party after work and you are drinking alcohol at may balak kang matulog, if may balak kang matulog, do not drink the alcohol within 3 hours before going to sleep. And then, avoid high sodium foods, yung naka-chichirya. Those are very high sodium. Or naka-pizza. Did you know that pizza is one of those high sodium containing food? Or cheese. So, why? Because those high sodium food affect vascular tone and vasodilation. Di ba nga sabi ko, for us to have a good sleep, dapat maganda yung circulation. So, if you eat a high sodium food, na-affect yan. And more so kung hypertensive ka. And kung ikaw ay feeling mo yung body mass index mo ay nasa obese to overweight, mag-ano na tayo? We do something to reduce that weight. Kahit mga 5% weight reduction, ang dami-dami na niyang magagawa to improve metabolism and in fact, fertility. Nakaka-improve ng fertility ang mag-lose ng weight kahit 5% from your baseline weight lang. How about other forms of sleep hygiene? So pag ikaw ay gusto mong matulog paggabi, so during waking hours, pag gising ka, you go out, expose yourself with the light. Ang ganda ng sun exposure natin dito sa Pilipinas, so lumabas ka. Increase daytime exposure to sunlight, ideally outdoors and open sky. Increase daytime physical activity. Kung gusto mong matulog paggabi, you do physical activity sa araw, wag nang sa gabi. Okay? Move at least once an hour. So sa may mga anong tawag dito, smartwatches dyan, maggawa kayo ng schedule, magba-vibrate siya every hour para you can stand or at least move, no? Ilang seconds or at least a minute every hour. How about stress? So sabi, pag gusto mong matulog, you minimize stress at least 1 hour before going to bed. So, paano mo gagawin yan? You start settling down. Warm shower, or nag-meditate ka na, or for those who are Catholics here, what we usually do is we pray the rosary within an hour before matulog. And then, if mag-music, yung slower music, the 60 beats per minute na music. Paano, doktora? Ginawa na namin yun lahat. Pero may difficult sleep initiation ako. Wala naman akong problema. Basta once I started sleeping, I'm okay. Kaya lang, I cannot initiate sleep. So I cannot start my sleep. So what do we do? Huwag kumain ng mabigat during dinner. You should have a low carbohydrate dinner. You keep a glass of cool water at bedside. Sabi cool, wag masyadong cold. Just a cool water at bedside to keep you hydrated. Okay? Because well-hydrated individuals can initiate sleep better. So baka dehydrated ka lang. And ayun, sabi, increase late afternoon hydration and avoid evening diuretics. Again, I was saying about hydration. So you drink lots of water, at least 3 liters a day, at least 3 liters a day. And wag nang mag-soda, mag-caffeine, and mag-alcohol. Ano yun? Ilang hours yun? At least 3 hours before your onset of sleep or before your scheduled time of sleeping. Ano pa ba? Paano, doktora, kung nakakatulog naman akong maaga, pero masyadong maaga din ako nagigising, 2, 3 a.m., tapos hindi na ako makatulog ulit. What do I do? Have sufficient bed covers to keep warm early in the morning because, you know, our body temperature changes depending kung you're about to sleep and you're about to wake up. Pag we're about to wake up kasi, our core body temperature, nag-i-increase na yan. And our peripheral temperature nagdi-decrease. Kaya we will feel pag nalalamigan na tayo, it's too cold, nagigising tayo. So you should have sufficient bed covers to keep yourself warm early in the morning. So mag-comforter ka or you choose a thicker blanket so you will not feel the coldness of the morning breeze. So nakakatulog kang longer. So hindi ka nagigising too early. And ayun, avoid bright lights. Yun na nga, you turn off the lights around you para hindi ka nagigising earlier than what you wanted or what you planned. So the question is sleep a luxury? So I hope that through this slides or through this video, you will be able to learn that sleep is a necessity. Hindi siya luxury. Hindi siya for selected people lang. Doktora, sa mayayaman lang yon. Kaming mahihirap, we need to work harder. We need to work longer. So, think again. Sa Bisaya pa, lawas ra ang puhunan. So, kung katawan lang ang ating source, so do not abuse, wag nating abusuhin. We should take care of it. So if you think that this video has helped you, helped you gain more knowledge about sleep or healthy sleep, don't forget to share this with others, okay? Don't forget to share this good knowledge to your friends, your relatives. You click that share button, i-share nyo na. Once again, I am Dr. Shi Armero, your friendly OBGYN lifestyle medicine specialist, and you are watching Doc Shi TV, your way of life. Thank you once again. So I hope you have learned from that video on sleep. Thank you very much. I have read a lot of reactions already, especially from my students who are studying medicine. Thank you for attending. Thank you for listening. So this is a different side of me. I am not usually this bubbly and bright during our classes. I'm kind of strict to my students. And thank you very much for being with me this afternoon. I hope you have learned especially the significance, why it is important for us to sleep. Mo na sa Bisaya, lawas ray puhunan nato, di nato abusaran. So, before I go to tama o mali, the segment where you will get a chance to win the free consultation coupon, I would like to invite all of you by next Saturday. We have a very controversial topic. I know a lot of you has been asking me already why I have not posted that res bakuna post like that. So next Saturday, you will hear guest. I am featuring guests who are experts, and we will be sharing to you what is the other side of the coin. Doktora, totoo ba na nakakabaog yung vaccine? Totoo ba ang COVID vaccine may effects sa fertility natin? What are the side effects on women? Again, because I'm an obstetrician, so I yung focus ko sa mga babae. But of course, no, we have male audiences also. Thank you very much. I know you love the woman in your life, so you share this to them. And so the vaccines, the ethical issues on the vaccines, we'll be showing it to you next week. And so watch out for it. I hope you will be with us again. So ayun, I'm inviting you. So lahat yan sasagutin natin. Just a warning because it's a controversial topic now. I hope you will also open your eyes on all these facts. So we now let's go to our next segment, the Tama o Mali Pop Quiz segment. Okay, ayun, may pagganon pa kami. Already, are you ready? Okay. So for our pop quiz segment, you need to type the PQ and the number, so I will know what number are you trying to say as tama o mali. The first one to say the correct answer, or hindi to say, to type, to chat the correct answer will win 4 free online consultation because it's our 4th episode. So our 4th episode na ngayon, so we will be giving away 4 free transferable online consultation coupon. Ayan na, lumabas na ang first question. Talagang pati yung staff excited to show the question already. Okay, ready na ba? Again, PQ number 1, tapos yung answer mo tama or mali. So i-type mong ganon. Because again, for the free online consultation coupon. Ready? Are we ready? Okay. Number 1. Okay. Tama o mali? The average adult needs 7 to 9 hours of sleep each night. Tama o mali? Okay. Hi, Car. You can type PQ. Okay. So, ayun, very good. Yun. Okay, ang dami ng answers are coming in. So, let's give away the answer. What's the answer? The answer to this question is tama. So, correct, that the average adult, regardless of the race, the answer is tama. We need 7 to 9 hours of sleep a day. What I usually tell my patients, at least malang 7 hours. Because if you sleep less than that, or you binge sleep as well because you have not slept for how many days in a row, if you binge sleep, you will also have the same cardiovascular disadvantages for those who have not slept at all. So just the right amount and duration of sleep is your target. Kaya mag-target ka 7 to 9 hours of sleep. So, yes, we are seeing correct answers already. Oh, yun. Wow. Let's go to our the winners will be announced at the end of the segment. PQ number 2 or pop quiz number 2. Tama o mali? The Philippines ranked the 4th spot along with other countries experiencing sleep deprivation. Tama o mali? Okay, 5, 4, 3, 2, 1. Yan. Let's reveal our answer. Let's reveal our answer. All right, our answer is for number 2. Tama. Did you know 4th talaga ang Philippines, no? It's one of the recent statistics that we are at the 4th spot. Diba nga in my slide, we are among the one of the top countries who are sleep deprived. Talaga bang very hardworking ang mga Pinoy at hindi na tayo natutulog? This is according to the Sleep Cycle's recent survey, an application that monitors hours of sleep, and that average sleep among Filipinos is only
6 hours, 30 minutes to 6 hours and 45 minutes per day. And oo, that's true, ano? So it's sad, but it's true. Okay, so yes, okay, we have answers already. Wow, ang galing naman ng audience. Okay, we go to number 3. Number 3? Okay, tama o mali? Ito ha. Mothers who feed their babies with formula at night have better sleep than those who are breastfed. Is it tama o mali? Mothers who feed their babies with formula at night have better sleep than those who are breastfed. Ayon. Okay. Okay, the answer is no. Diba I said, those who are breastfeeding will be able to sleep 40 to 45 minutes longer than those who formula feed their children. Because the hormone prolactin, so we have a lot of hormones in our body and prolactin is among it. And prolactin is the one responsible to produce the breast milk, has a very big role in stabilizing sleep. So, di ba, duration and quality are equally important. And so, truly, mali. Breastfed, those mothers who breastfeed their children can sleep longer and better compared to those who formula feed their children. Okay, we go to, let's see. Ayun. Ang galing-galing naman ng audience. Okay, we're down to our last pop quiz. It's our fourth pop quiz question. Tama o mali, sleep is a luxury. Para lang yan sa mayaman at sa mga hindi nag-aaral ng medicine at talagang may nag-comment na medicine student na gustong-gusto niyang hindi makatulog pero nakakatulog pa din siya. So, parang lang ba yan sa hindi nag-aaral ng medicine at para sa mga hindi nangangailangan ng sweldo at trabaho? Ayan, parang, uy, very good naman, ano? Let's reveal our answer then. Mali! Galing-galing, very good. Okay, yes, it is mali. As I said before I ended the video, sleep is a necessity. Sleep is a necessity. Okay, kahit anong estado ng buhay, we really need to sleep because we need to recharge, we need to rejuvenate ourselves. If not, we become unproductive. I have a secret to my students who are watching, my med students who are watching here. When I was in med school, I really make sure that a night before a major exam, I try to have a good quality sleep. I just lift it up. So I really believe in a higher being. And so I just rest. Lord, I lift it up to you na sana pagka-exam ko, ma-answer ko ng maayos. Because even if anong tawag dito? Yung nagka-cram, no? Hours before the exam, lalo tuloy akong hindi nakaka-answer sa exam. So for those of my students who are watching with us, that's my secret. I get a good night's sleep. Okay, I hope you have learned from this pop quiz, tama o mali, and I enjoyed looking at how good you are. I hope you enjoyed as well. And winners will be announced at the end of our Q&A segment. Okay, so now we are at the part where we will go and answer the frequently asked questions. Okay, because we have subscribers, we have viewers in our Facebook page who message us, who shoots us a private message on certain issues that they would like to share with you, so I can also share my answers to them with you here live. And so, let's go to okay, ask Doc She. So, question number 1. Is it safe sa buntis kung susuka na may kasamang dugo? Naku po, ang pagsusuka is expected in pregnancy. But if may dugo, eh hindi na yon. Hindi na yon pwedeng ganon. Perhaps because of too much retching, yung paggaganon mo, you're enduring the passages, kaya ka may dugo na. So you should seek professional help. Hindi pwedeng, anong tawag dito, sarilinin mo ang itong karamdaman na ito. So, pagpatingin ka, baka mag-gastroenterologist ka, tapos titingnan kung wala bang sugat dyan sa loob. Kasi it's because of too much retching. The problem there, what's causing the severe vomiting? There are several other conditions in pregnancy that cause severe vomiting. Number one, can be thyroid problem. Number two, urinary tract infection also presents with severe vomiting because parang it's a way of the body to eliminate the bacteria brought about by the urinary tract infection. Kaya sinusuka. Akala ni body na kaya niyang i-eliminate ang bacteria through vomiting. Kaya severe ang vomiting, mas severe ang vomiting ng buntes na may urinary tract infection. So, magpatingin. Hindi pwedeng hindi magpatingin. Okay. So, I hope I answered that. We go to the question number 2. Number 2, nakunan po ako last week, Doc. Pero nung nag-PT ako kanina, positive pa din. Bakit po kaya ganun? Okay. The pregnancy hormone that we detect in the urine, yung tinitest natin, I'm assuming pregnancy test kit lang, home preg test kit. Hindi siya nawawala immediately pag nakunan tayo. In fact, for those we monitor the beta-HCG level, it can last at least around 3 weeks or more bago talagang mag-negative. If gusto mo talagang malaman if the beta-HCG level is decreasing at talagang non-viable na yung lumabas na pregnancy o baka dugo lang yun. So, tingnan natin. If you are really suspicious, you can have your blood beta-HCG determination quantitative. Kasi pag nakunan ka, hindi yon magzi-zero agad. Okay? From, say, for example, 1,000, mag-500, mag-200, mag-100, and those values will still produce a positive pregnancy test because a negative level of beta-HCG is between 0 to 50. So pag beyond 50 ka, positive pa din yan sa result ng pregnancy test. Okay? So, let's go to our third question. How can I stop birth control? Okay, kung nagpipills ka and you want to stop birth control, you stop right away. Wag ka nang mag-take. Stop taking it. Ang downside lang siguro dyan, if nagpipills ka at bigla-bigla kang nagsistop in the middle of your pack, you will bleed. Parang ang tawag dyan, withdrawal bleeding. Because those hormones that you take in, it controls our reproductive tract na hindi siya mag-shed off while you are taking it. Supposedly, after your pill pack, once the hormones are withdrawn, dun ka na mag-mens. In the middle of the pill pack, mag-mens ka na hindi scheduled. Okay? Hindi scheduled mens ang tawag doon because nga, you stop your birth control pill. In fact, for those who forgot to take their pills, kaya my instruction really, especially for those I treat for hormonal imbalance, I really instruct them, you take it the same time every day at huwag kalimutan because once you miss, nagkaka-hormone withdrawal yan at baka mag-spotting or baka talagang mag-bleed ka na. Okay? So, number 4. Question number 4. Ayun, PCOS po ako at huminto na ako sa pagpipills. Babalik po ba ulit ang pagiging irregular ko? Okay, this is a very good question, especially that PCOS is a very common condition now, especially these days. I would like to emphasize that PCOS is not treated by pills. The pills will just help. The pills will just assist you while we are doing lifestyle changes. That's why nga, ang galing Obi nga, until now, I'm very blessed that I got to discover lifestyle medicine. Again, through my parents. My parents are here watching with us. Thank you very much. They're very active in lifestyle medicine. And they're the ones who introduced it to me. It has improved my practice because I learned a lot of lifestyle conditions na we just treat by medication. Ang bilis, oh, ito, mag-pills ka, ganyan. Without even explaining what's really causing it. PCOS is caused by too much cholesterol. The cholesterol becomes a male hormone that causes PCOS. So, nagiging cycle yan siya. So, you have to understand that the pills will just help you menstruate every month while you are taking it and while you are trying to create a regimen to improve your lifestyle. Kasi kung hilig kang baboy, hilig kang manok, hilig kang itlog, tapos bigla kang sabihin, Dr. Amero, oh, mag-diet ka, mag-lose weight ka, ganito, ganyan. Dapat pagkabukas, ngayon 70 kilos ka, bukas, ano ka na, 50 kilos. Pwede ba yun? Di ba hindi? Kaya, pills will help us transition from our not so good lifestyle to a better lifestyle. Eh, hindi yan siya overnight. So, it depends upon how you are committed in changing your lifestyle. So if it can already, if you are already committed that by the end of the 3 months, Doc, kayang-kaya ko nang i-maintain. I'm very consistent with my exercise, with my whole food plant-based diet. I'm very consistent. Parang kaya ko nang i-let go ang pills after 3 months. So of course, go ahead. Okay, I'm very good with that. That means you are in charge. Talagang kayang-kaya ko, I can modify this disease through my lifestyle, and I'm confident I'll be able to do this span of time. So I'm giving that responsibility to the patient. So to answer this question, pag PCOS ka at nagpipills ka, magiging regular yung menstruation mo. But if you stop taking the pills at hindi ka nag-modify ng lifestyle mo, babalik yung pagiging irregular mo, unfortunately. At sasabihin mo, nako, pangit nung OB ko, hindi magaling kasi bumalik ulit yung PCOS ko. Si OB pa ang na-blame. Pero actually, the PCOS is brought about by, again, the lifestyle that we do. Kaya, it's very important to emphasize that you should be able to modify your lifestyle together with taking the pills para holistic ang ating approach. Ayun. Okay. Can we move on to the next question? Yun, my dear, ang galing naman, nag-follow instruction talaga, oh. Dear Doc Shi, exact ba ang fetal aging sa ultrasound? Wala bang plus or minus? Like yun, sa result is 6 weeks and 3 days. Okay, this is a very good question. The ultrasound, the estimate age of the ultrasound depends on how early you did your ultrasound. So for this patient, she had a very early ultrasound, which is 6 weeks and 3 days. So naka-crown rump length from the crown to the rump of the baby na measure yan. So the most accurate ultrasound estimate of fetal age is the crown rump length, or the CRL. So for those med students watching, that's why it is important that we do prenatal early, especially for those unsure, hindi sigurado sa regla nila. Hindi sure, kasi ako, Doc, irregular ako, hindi ko matandaan ang first day of menses ko. So pag hindi mo natandaan, it is the first trimester ultrasound that is accurate in estimating the fetal age. Pero kung sigurado ka naman sa first day of menses mo, and pinag-ultrasound ka ng first trimester at hindi sila exactly the same, but it is within the 3 to 5 days difference, we follow your first day of the last menses. Because the accuracy of the ultrasound, tama, may plus or minus. Pag nasa crown rump length tayo, nasa plus minus 3 to 5 days tayo. And as the baby grows, nagiging 1 week ang difference, nagiging 2 weeks ang difference. Kaya we really emphasize, no? I always teach, will always explain to my patients why it is important to get a first trimester scan para ma-compare natin kung talaga bang accurate ang first day of the last men's recall mo. Kasi 'di ba, recall, we are relying on recall only. And so mas magandang talagang ma-coincide natin with ultrasound aging. Ayun. I guess parang nag-5 questions lang tayo so we can entertain. Talagang na-flash na. We can entertain questions from the live audience. Hello, Mia. Mia is one of my students. Doc, nag-aaral kami with coffee and laptop, pero ba't inaantok pa rin kami? Mia, I'm happy that you are studying, but coffee is number one, not very healthy if you rely on coffee. Okay. The reason why you become sleepy is because you have several sleep debts already. Kung kung sa utang pa, pag masyado ng malaki, kahit magtrabaho ka pa 24 oras, hindi mo mababayaran yon pag masyado ng malaki ang utang natin. So if you have a very, ang dami mo ng sleep debts, no? Kahit anong gawin mo, kahit ilang coffee pa yan, hindi ka pa din stay awake. So, if you are sleepy, wait lang muna, if you are sleepy, try to sleep. Again, duration and quality. You let go of everything. You try to nap. Tulog ka, Lord, patulugin mo ako. You know one of my prayers, Lord, please give me kahit 2 oras lang, please help me rejuvenate my mind na pagkagising ko at I can read and understand what I'm studying. Mas magiging productive ka. Kahit nakatulog, you wasted hindi talaga talagang wasted ang ginamit ko, no? Kahit nag-spend ka 2 hours of sleep just for your brain to be rejuvenated, it's already a very big help. Promise. Ayan, last February 2020, na-diagnose ko na ay PCOS, wala na ako kabalik pa check tungod sa lockdown. Okay, so pag ganon, don't worry, I have a video. You go to my YouTube channel, Docshi TV. I have made a video on PCOS, and I also plan to post another video again on PCOS because a lot of you has been asking about PCOS, so I will post another one. And if you really would like to have a consultation with me, we have online. So yun, may online consultation tayo para wala na talagang reason na, Doc, malayo ako sa hospital, takot ako magpunta sa clinic. O yun, we have, bilis-bilis naman, we have online consultation available. Hi, Doc, my mother is 48 years old na. She had regular mens before. But karon, di siya 2 months. Is it possible? Okay, if possible, what are the risks? Okay, for us to know if she is pregnant or not, we have cheap home preg test kits available over the counter. We can buy that for her and then try to do the test, okay? Baka lang kasi she's 48. You know, the average Filipino woman will have their menopause at 47 to 48 years old. At naswak siya sa 48 years old. Baka this is already her perimenopausal stage kasi nagiging irregular talaga ang menstruation sa nagpi-perimenopause. But let's say, Doc, I think talaga she's pregnant. Of course, there are several risks. Number 1, congenital malformations. Pero I had patient, pero medyo younger naman nasa 47. I thought she's accompanying another patient, but she was my patient pala. But thanks be to God, wala namang abnormality si baby, So those things are just beyond our control. We lift this up to God. What if she's pregnant? Do not delay the prenatal. Let her start prenatal early so an obstetrician can help take care of her. Ayon. Okay. So, is it, sorry. Next question. Meron pa ba? Okay. Hi, Doc. Is having myoma not a risk as long as it is monitored every 6 months through ultrasound? Okay. Thank you for that question, Marina. Pag myoma lang talaga, myoma is a benign condition and it has no risk of progressing to cancer. And so if maliit lang siya, huwag nang magpa-opera, monitor lang natin yan siya every 6 months, especially this time of pandemic. Personally, if I'm your friend, I would advise against having you undergo non-emergency surgery at this time because you will be exposing yourselves with a lot of infection in the hospital, most especially, we're at the pandemic now, COVID ngayon. Here's my tip for you. Pag maliit lang si myoma, you know what's feeding the myoma? A hormone that feeds the myoma is estrogen. So, for you, para i-starve siya, ito na lang yung term natin, to starve the myoma, para hindi siya lalong lumaki. do not feed it with excess hormone. Saan mo nakukuha si estrogen? Galing pa din sa cholesterol. Yung mahilig ng fried, mahilig ng pork, mahilig ng chicken, mahilig ng egg, any meat products, nagiging converted into hormones yan sa katawan natin at it feeds the myoma. There are several studies that show that hormones feed the myoma. So mag-exercise ka. Kung feeling mo, Doc, ang dami kong stored cholesterol sa katawan, so mag-jogging ka. Wherever you are, there might be a walk with the dog in your area. You go with it. Okay, hi Faith. Is it safe to take melatonin tablets? Okay, it's commercially available, but you know, there had been a lot in online. Just make sure it's approved by Food and Drug Administration. Okay, tingnan mo na lang. You check on the label, no? You become more anong tawag dito? Let's look at the labels whether or not it's approved by Food and Drug Administration. Okay. Do we have more? Hi, Cinco family. Thank you very much for being with us this afternoon. Okay. Thank you. If we have, ayun, bakit ito, si number 5 lumabas? Nasagot na ito. Okay, all right. Wala na daw. Okay, wala na daw question. I hope you have learned with this afternoon's session, DANGPANAN. Ayun, may nakahabol pa. Okay, hi Doc. Is reddish brown urine a sign of urinary tract infection? Okay. The reddish brown urine can be because of the food you ingested. Okay, pwede if you took in highly colored food that is reddish or brownish, or you are dehydrated, pwedeng very colored yung urine natin. However, if you are suspecting that something is really wrong, wala naman akong nakain, Doc, wala naman akong nainom na highly colored, usually a red urine is not just a sign of infection, it's also a sign na baka this is stone, maybe this is lithiasis, we call it in medicine. There's a stone that is forming that injured, nag-brush siya sa lining of the urinary system, kaya red yung urine mo. So, number 1, yes, that's correct. Probably there's also a UTI that goes with it, so get a urine test. Pag makikita mo sa urine test kung may nana ba doon, totoo ba talagang may red blood cells doon, kasi nakikita sa urine test kung totoo bang may red blood cells, or baka it's just the coloring from the food we took in. And of course, nakikita din pag may crystals doon. So it's a very big help na magpa-urinalysis ka and catch the midstream. Ano bang midstream, Doc? You drink, you hydrate yourself well, and then you catch the midstream of your urine para clean siya. So your urine becomes clean, okay? Clean catch, hindi naman talagang clean, hindi naman nagiging clean ang urine. So ayun, you have a midstream clean catch urine. Okay, may iba pa ba? Oh, thank you, Dr. Veloso, for always supporting me. She's watching in YouTube. My partner pediatrician, Dr. Veloso, is also watching with us. Thank you very much. Okay, I think we have answered all questions already. Let us reveal our let's reveal our winners already if we're good. Okay, so we go and reveal our winners. Are you ready? Wala bang background dyan? Ay. Okay, we will be showing, so watch out for your names, okay? So here, wait lang we'll be showing it shortly. Congratulations! Okay, let's have our first winner. Our first winner who was able to answer tama in the first question. Uy, walay pabor-pabor. Hello, Ate Jeannie. Thank you. You're a winner for 1 free online consultation. Okay, thank you very much for your support for watching with us this afternoon. Our second winner is yung nakasagot ng tama. Okay, our second winner is Maria Salome Tabaranza, you were able to correctly answer our tama o mali segment. Very good. Ang galing-galing. Okay. Our next winner for PQ number 3. Let's see. Hello, Fernan Norven Malaga Abangan. Okay, you answered correctly. PQ number 3 is mali. Yes, very good, because breastfed or breastfeeding parents are able to sleep longer than formula fed. And our last winner sa PQ number 4. Teneng, teneng. Teneng, teneng. Tingnan natin. Okay, mali pa din. Miss, ayon. Hi, Ma'am Marina. Ayan, you got it correctly. Mali. Yes, PQ number 4 is mali. Once again, congratulations to our winners. Ayan. Okay, ang galing-galing nila. They were able to answer correctly. So, pabilisan ito ng type, no? You type. So, you message in our Facebook page. You just tell my booking assistant that you won with the Tama o Mali segment, okay? And so we will already give you your consultation, free online consultation coupon. So we will be the one to send it to you once you message in the page. So ready na, my staff are ready to respond to you. Okay, so thank you very much again for joining me this afternoon. But before we close this program, I would like, to feature one of very good testimonies from one of my patients. This will just tell us how important it is for you to take charge of your health. So here it is. This is from Faith. Faith is watching with us. Thank you very much, Faith. San ba ako? Ganyan. Okay. She said, I was diagnosed with PCOS in 2015 and did not really do anything about it. It was not until January last year when I decided to intentionally address my PCOS. Still got a long way to go, but thank God my menstruation has been regular for more than a year now. Before, once a year, I get down. And thank you, Faith, for this testimony. Yes, I was in, Faith is very, religious in her follow-up, and she never hesitates to really ask help, to ask for advice on how to go it. Lifestyle modification is not easy. That's a very real concern. I cannot tell you to go change it overnight. It cannot happen. So it will take time. That's why I'm asking you, if you were my patients, I always tell you, how long can you possibly do this lifestyle change that I'm advising? And so, thank you very much for this wonderful testimony. I'm sure you are able to inspire, especially those who are asking about PCOS. So, indeed, we have another wonderful educational Saturday afternoon with you. Thank you very much from the bottom of my heart. I am here because you are all here, because you are here to gain correct and science-based information. If this episode has blessed you and you want to bless more people, don't forget to give that share, like, and subscribe for us to reach more people, because we can be safe and healthy at the same time. All my lovies, thank you very much for this wonderful afternoon with you. See you next Saturday.